Hi, good morning, Dr. Goodman. How are you today?
Good morning, Adarsh.
Um, so I have a few questions for you. What should people do first when they join residency?
Well, first off, it's a very tough transition. Try not to be too hard on yourself. I know when I was starting residency, the whole first 6 months I spent trying to figure out what other job I'd do after I got fired. So if I can make it through, everybody will as well. I think what people should think of first is trying to get themselves organized, their own to-do list for the day, and setting up the order of your day. That's really the key.
How should people handle the first floor rotation?
So you're probably going to have a floor month in the first 3 months of your year, and in most places you carry around 6 to 10 patients on any given day. So you have to organize your day and your work, like for instance, leaving notes for later in the day as they're not, something that needs to be done stat, and making sure that things like orders get done very rapidly so the nurses can carry them out. And you can even do that on rounds if you have a computer near you or a computer on wheels, as many places have, as you go around and see patients. Make sure you do the discharge summaries early. That can otherwise really hold up the interdisciplinary team and make the discharges be delayed. Call the consults relatively early as well. You don't want to be the one calling a cardiology consult at 4:30 p.m. and being on the end of that screaming phone call. And then overall, for the first few months, don't be afraid to ask for help. The residents on the team know that you guys are going to need help early on, and you should look to them for guidance. Also, in general, just finding out as you do admissions the disposition issues that are going to come up for that patient relatively early on, so you can really help plan the hospitalization, and overall that will help with your throughput. In the first few months, I think you'll probably settle in just enough to maybe start looking things up about your admissions that night when you go home. So on rounds the next day, after you present your case, you can even add maybe a little teaching point. That would be part of that teaching milieu as well.
Absolutely. How about the first unit rotation?
So yeah, it's a very different beast than the floor rotations. You're going to carry a lot less patients, but of course, they're going to be a lot more complicated. You really want to make sure you start the morning getting all the information that's necessary for rounds, vital signs, I's and O's, all the things that happened overnight, and have them ready on rounds to present and update the team with. And overall, when you're presenting your cases on rounds, you want to be thinking by systems, as opposed to, say, the floors where you're doing it by medical problem. Here you want to be able to go throughout the systems, cardiovascular, respiratory, et cetera, and tell everybody what we're doing in each of those areas. Even doing the admissions, be thinking through the systems as you do the admission to make sure everything is covered. And then another useful point, I think, would be to look to the nurses. Those unit nurses frequently have years or decades of experience, and they can really be helpful with regard to the patient care as well.
Absolutely. How should people handle the ambulatory rotation?
So a couple of things I can think of. One would be, for each individual patient that you see, learn to negotiate the agenda early on in the visit. For instance, you might want to find out from the patient what things they want to accomplish at that visit, and then of course maybe by looking at previous notes before the patient walked in, you'll have an idea of what you think is important for that visit, and then in the first 30, 60 seconds of the visit, come up with some sort of synthesis of those two so you know what you're going to now spend the rest of that 15-minute visit on. That'll really help you overall. And then as a systematic way of thinking in ambulatory, figure out how to handle your review queue every day, where you have test results, consults that come back, all of those things that you ordered from previous visits. You're generally responsible for following up on these things during a time when you're even not in clinic. And so make sure you have some sort of system in place to be on top of those issues.
Thank you so much, Dr. Goodman. Thank you so much for all the helpful pointers.
Yeah, hope it helps some of the new interns coming up.